Well, thanks for coming into OMS of Utah. I'll come in a few minutes and let you know how things went during surgery. But once we are done with surgery, we'll have your patient bite on gauze a good 45 minutes to an hour. That'll help with the bleeding. Sometimes you'll get some oozing for the first 24 hours. That's pretty normal. After heavy bleeding is done, if you want to take the gauze out and you can tolerate it, then you can take it out. That's fine. If you want to keep it in, if you feel more comfortable with it in, that's okay too. But if you're still bleeding heavily, then black tea is a good thing to get from the grocery store. Black tea is best because the chemicals in the black tea will help coagulate the blood. You just dip it in cold water, bite on that for an hour or two, and that bleeding should stop pretty quickly. The numbness, they are going to be numb for quite a while. I usually like to use long-lasting local anesthetics, so that should help keep them comfortable. Lower lip and chin and tongue, usually 10 to 12 hours. If we use Exparel, then around the wisdom teeth site should stay numb for 2-3 days. So that should help keep them comfortable. I did send into the pharmacy prescriptions for pain. Most typically will send in both ibuprofen and tramadol for pain. If the patient can do ibuprofen and Tylenol as the main painkillers, that's what we recommend. Most people do well with that. If it's not doing the trick, then they can take the tramadol or the opioid as well. If it is different than tramadol, then I'll let you know. But like I said, our goal is that they don't have to use anything more than ibuprofen and Tylenol to control the pain. Get some food in them in a couple hours. I usually recommend doing cool, soft foods for a day or two. Warm foods tend to make things swell and ooze more. So if they can do, Jello, pudding, yogurt, ice cream, that kind of stuff for the first couple days, that's great. If you can stay away from chewing food for the first week, I usually recommend that because food getting in the sockets is the most common reason for an infection. And so if we can stay away from that while we're not using the syringe, that would be great. Once they start using the syringe, then you can advance your diet and clean out those holes. I know there's some conflicting time periods to start the syringe in the video. I usually recommend if they can wait a week, that's usually best so they don't give themselves a dry socket. But if you start having some discomfort and pain, at day 5, it's possible there's some food in there. You can gently use the syringe at day 5. And if that's not helping, then obviously let us know. But if we can keep those holes clean, that's gonna help prevent infection. Peak pain and swelling usually hits day 3, so keep that in mind. Day of surgery is day 0. And so 3 days after, is usually when you hit that peak, and then it should taper off after that. If it's not getting better, and it's not, all of a sudden day 4, they're 100% better, but, if they're not progressively getting better or things are getting worse after day 3, then make sure to let us know. We appreciate you trusting us. Thanks for coming to see OMS of Utah and me. We appreciate your business. Thanks.